You see them flying.
I forgot to grab it. So, oh. Hanging on my.
Media, are you ready? And just make sure we have quiet in the room, please. Yeah, thank you.
Good morning, everybody. Can you hear me okay, folks? My name is Debbie Hayes, and I'm the Upstate New York, Connecticut, and New England Area Director for the Communication Workers of America. Thank you for coming out today as we kick off the 2025 contract negotiations between Kaleida Health, 1199 SEIU United Healthcare Workers East, and the Communication Workers of America, AFL-CIO. Kaleida Health is the largest private employer in Western New York with over 11,000 employees. The unions here today represent approximately 8,000 of those workers. The bargaining units at this bargaining table that you see circling the room here cover employees that work in dietary, housekeeping. We have nurses, aides, and clerical staff, imaging technologists and respiratory therapists, laboratory scientists, therapists, social workers, LPNs, RNs, physicians assistants, nurse practitioners, and many, many more job titles. Bargaining at Kaleida is significant not only because of the size of the business, but because Kaleida Health also delivers critical healthcare services to hundreds and thousands of community members each year. It's a system that experiences over 1 million visits per year. Our members are the backbone of a system that provides all level of care, from primary care and women's health care services to highly specialized and complex treatment for the most serious medical conditions. So we are anxious to get back to the bargaining table and negotiate over the complex issues that our members face every day when they go to work. We have a number of speakers here this morning that will speak specifically to what those issues are. And we're going to start with Cathy DiFlavio, who is an RN and an administrative organizer for 1199 SEIU.
Thanks, Debbie. Good morning, everyone. We are happy to start bargaining today. It is our first session. Our goal is to reach an agreement by the time this current contract expires, which is May 31st of this year. Our priority is always to make sure that we're doing the best for our members, which, like Debbie shared, are about 8,000. And our focus then is to get that an agreement and then get back to taking care of our patients in the community and provide quality care.
Thanks, Cathy. Our next speaker is going to be Cori Gambini, who's president of CWA Local 1168.
Good morning, everybody. Our members have clearly expressed their views through our recent surveys and by us having conversations daily. We saw an unprecedented level of participation from our employees, indicating a high level of engagement and desire to be active participants in this process. The membership is looking for a robust wage and benefit package to attract and retain experienced healthcare professionals who deliver quality care to our patients. And this package must include enhancements to pension. Moreover, our members are firmly opposed to any concessions from management. As we head into critical contract negotiations starting today, for our dedicated healthcare staff, we are committed to advocating for equitable wages, comprehensive benefits, and improved working conditions. Our bargaining committee embodies the spirit of solidarity and empowerment. And we stand united in our efforts to secure a collective bargaining agreement that enables us to provide exceptional care for our patients and our members. We are prepared, we're ready, and excited to get to work starting today. Thank you.
Thanks, Cori. I'd like to introduce our next speaker, who is Cheryl Marino. Cheryl is a social worker and also an administrative organizer for 1199 SEIU.
Good morning, everyone. I'm just going to probably reiterate what everyone said, but we are very excited to be here today to kick off this bargaining for 2025. We have been meeting with the bargaining committee now since November. So we have caucused, we have written proposals, and we are ready to get this started. Our belief is we have the best healthcare workers in Western New York. And we are going to do the best we can to make sure that we provide the best contract back for ratification and hopefully the end on May 31st. So thanks, everybody.
Thank you, Cheryl. We also have 4 member speakers that are going to speak this morning. So let us just quickly shift seats and we'll turn the microphone over. Member speaker is going to be Mattina Chmiel, who is a registered nurse, and she works on the Buffalo General, at the Buffalo General Medical Center.
Hello, my name is Jena and I am a proud nurse at Buffalo General Medical Center. I love being a nurse, I love being a healthcare worker, but most of all, I love being a union nurse. As a nurse, I care for members of our community when they need me most. Whether it's managing critical medications, advocating for patients, providing life-saving interventions, showing compassion to family, or simply holding a hand during a difficult moment. Every day, I make split-second decisions along with thousands of other Kaleida Health nurses that impact lives. But I can't do this alone. Safe staffing, fair wages, and a voice on the job aren't just about us as nurses, they're about the quality of care our patients receive. Right now, we are fighting for a fair and just contract, one that ensures we have the staffing, the resources, the safety measures, and the respect we deserve. Because without that, nurses like me aren't going to want to stay. And when nurses leave, it's the patient care that suffers. I want to remain here, serving my community with dignity and respect on the job. That's why we're standing together, because when we fight, we win. Thank you.
Our next speaker is Betty Thompson. Betty, who is a veteran of our bargaining here at Kaleida, is a patient care assistant at Millard Fillmore Suburban Hospital.
Hi, my name is Betty Thompson. I work at Millard Suburban. I'm a patient care assistant, and this upcoming bargaining staffing is very important to me because without more staff, I can't take care of my patients the way I would like to take care of them. And I'm here to help and serve patients. So for this bargaining, I would like more staff.
Our next speaker is Josh Morley. Josh is a medical assistant who also works at the Buffalo General Medical Campus.
Good morning. My name is Josh. I'm a healthcare worker at Buffalo General Medical Center. I love the work that I do in healthcare, and being a union member has made it even more special to me. It takes every team of healthcare workers to ensure the safety of patients and provide quality care, but it is too often that we are overworked, underpaid, and overlooked in the quality of outcomes for our patients. We are medical assistants like me. We are laboratory assistants. We are respiratory therapists. We are pharmacy technicians. Just to name a few that are essential to the care of our patients. We are all essential. Short staffing means we are stretched thin. High turnover and many job titles makes it hard for the remaining workers to stay, and without the respect that these workers deserve, it has been demonstrated that they will leave. This is why we are fighting for a fair and just contract, one that recognizes the true value of every healthcare worker. A contract that ensures safe working conditions, livable wages, basic dignity and respect, because when we are treated fairly, patients receive better care, the care they deserve. I started with Kaleida Health when I was 18 years old. I want to stay here. I want to serve my community knowing that my work is respected and that when we stand together, and that is why we stand together, because when we, the workers, stand together and put up a fight, we will win. Thank you.
And our last speaker this morning is Lisa Simmons, also a veteran negotiator who is a patient representative, registration representative at Oishei Children's Hospital.
Good morning, everyone. My name is Lisa Simmons. I've been at Kaleida Health for going on 17 years. I currently work in the admissions department, and my job for patient registration is located in Oishei's emergency room. So within my department, we are one of the first faces that our patients see. So we have to be ready to give them a little encouragement, no matter how long they have been waiting to be seen. So we have to be, you know, treated with dignity and respect, because we have to treat our patients with dignity and respect. And with short staffing, the wait times are long. The patients do get irate. It's overwhelming. You go from room to room not knowing what you're gonna get from each patient because they're going through crisis. And a lot of times with the short staffing, that energy from the patients being irate and upset, it transfers over to you, because you take the brunt of it all day, every day. So with what everyone said, short staffing, as far as being safe in a safe environment, we are all human beings and we are not robots, and we need to be treated as such. Thank you.
Are there any questions from the press?
How many people are you guys bargaining on behalf of?
So about 8,000 members between the two unions, spread out over a number of sites throughout the Western New York community.
Why don't we? John, your question?
Yeah, this question might be best for Debbie, but I guess with the Catholic Health Talks happening and, you know, at the same time as the Kaleida Health Talks, does that create any kind of opportunity to kind of push for changes in parallel?
Well, Catholic Health and Kaleida Health are true competitors, and at this point, there is a competition or work that's done not just around visits and volume. There's also a competition for workers. So in this community across New York State, across the country, there are not enough people in the job titles that are actually at the bedside doing the work. So what we saw in the last set of negotiations between 2021 and 2022 is everybody trying to learn what the other entity is doing in terms of wages and benefits. So things like the staffing ratios that we were able to negotiate in both agreements, a healthy wage and benefit package, good work conditions are all things that we definitely will kind of leverage each other with each other.
What are some of the other sticking points that possibly come up?
Well, I think, and other folks should jump in, but the two primary things that we've heard from our member survey revolve around safe staffing. Is the first. We have, number one, a law in New York State on clinical staffing committees that requires all general hospitals across the state to meet with workers in the facilities and put a staffing plan in place. And so far, it's been difficult at almost every facility where we represent workers to meet the staffing ratios that have been sent to the state. And while that covers nursing, we also have shortages in other departments where folks are working that makes it difficult to do the work. And the area that always comes to mind are our laboratories, where there just are not enough clinical laboratory scientists, medical technicians, and folks that can do that work. So we are seeing the shortage across the spectrum of job titles. The other thing, and I think Cori touched upon it a little bit, and I may have referred to it in my response to John, it's just that there has to be a competitive wage and benefit structure. Our folks go through a lot when they walk through the doors and go to work every day. And we need to make sure that we have good, high quality jobs, that we can pull in the right people to do the work, and that once they start at a Kaleida facility, that they're willing to stay there and make it a career.
Cheryl or Cathy, did you want to add about service jobs?
No, I think just competitively, I mean, I think Debbie stated it correctly. I mean, our biggest issue right now is recruiting and retention. And so that's going to be one of the major issues. Obviously, we need to be competitive in the area, but we're short on a lot of job titles, clinical lab scientists, pharmacists, EEG techs. But, you know, we'll get there. And we believe that if we are able to negotiate a great contract, that we'll be able to recruit those individuals.
Because as a registered nurse, I can't do my job without those other job titles. It's very important, whether you're a medical assistant, a PCA, you're in environmental services. Every person relies on that coworker, regardless of your job title. So it's important that we get the staff for every bargaining unit that we represent, so we can do the care we need to do.
Yeah, and I think some of the challenges are definitely gonna be is the, on the national level. So everybody knows our healthcare system in the United States is broken. If you don't, I don't know how anyone did not know that. We spent a lot of money and, don't have the greatest outcomes in the United States. And with the administration sitting in Washington at this point with the threats of Medicaid and Medicare cuts, will directly impact our hospitals. And at the end of the day, they're as monumental as, you know, the hype is right now. It'll be disastrous. I mean, I would imagine that hospitals would have to close if they come through the way they want to come through. So those are going to be the challenges, I mean, really just sprung on us. So when we were preparing for negotiations 3 months ago, then these, you know, the election happened and then the announcements started coming out, the changes when they took office. And these are going to be challenges that we're going to have to figure out how to navigate. And I'm confident that we will, because when we fight, we win. And that not only includes our employer, but our employers that where we represent members, but also with the government. So
What Cori is referring to is the $880 billion in cuts, federal cuts to Medicaid, which will devastate local hospitals and nursing homes if those cuts were to go through. Any additional questions? Otherwise, we're going to wrap it. Okay.
Yeah,
Thank you. Thank you very much, folks.
hello?
What's Oh, yes, Steve, I will send you the list